The welfare of the flock is definitely affected by reduction in antibiotic usage. We in the industry on the production side can overcome some of these disadvantages from antibiotics, and it will require us to do better in a lot of our practices, and that's a good thing. But in situations where we do have disease outbreaks, being able to use antibiotics as a tool for disease control or eradication is very important. And in a claim such as no antibiotic ever or completely antibiotic free, that's going to definitely decrease the welfare of those birds. If they get sick with a bacterial infection, something that an antibiotic could treat, but we're not allowed to use that, then it goes against the oath that veterinarians take when they register to be a veterinarian. It also decreases production for the producer, and so the economics of their business are hurt. It's going to decrease the quality of the chicken that's being produced, which is going to decrease the product that comes to market, and it's going to increase the price of that product because we're not able to be as efficient as a production system as we could have been in the past if we had that tool available. Now, we are working to overcome some of those deficiencies with vaccines, with different production practices. But at the end of the day, there still will be a large need for therapeutic usage of antibiotics to prevent, to treat, and to control disease outbreaks. Using alternatives to antibiotics is an area of intense research at the moment. And I would say there's a decent database of research that's been published, and it's continually building. Now, there's not as much research in these products as there has been in the past in antibiotics or vaccines or even some chemical therapeutics that we use. Minerals, spices, organic acids, inorganic acids, things like that are really, probiotics, prebiotics are in the forefront of these categories. And there are some that show promise, but so far there's nothing that's been able to replicate the efficacy of using an antibiotic. Even in combinations, you can see small effects, but you don't get the population effect that you get when you use an antibiotic product. Now, that may change in the future. Maybe with more intense research, we could get to a point where we find some silver bullet to, alleviate the deficit that we will incur without the use of antibiotics. But at the moment, we just don't have a product that can match the efficacy.